Welcome. My name's Chris Davis. I am a certified keto carnivore nutrition coach, and today I'm on a mission, or I'm continuing my mission of diving into the research, quote unquote research, and seeing what's what when it comes to what we have been told about what we should or shouldn't be eating. So I found an article while I was looking in Frontiers in Nutrition's website. The article was published in July of 2021, so not too long ago. The title is Ketogenic Diets and Chronic Disease, Weighing the Benefits Against the Risks. So about a page and a half into this, I decided to stop reading the article and look at who funded it, because this is important to note. So the study was funded by the Physicians Committee for Responsible Medicine. They are a nonprofit, but they do encourage a vegan diet. Do you think they have partiality about animal products? Probably not. My guess is it's skewed, and that's what led me to determine I need to look and see who funded this because of the first page of information. In their opening paragraph, right, they talk about diet quality, right, and talk about typically increasing intake of foods linked to chronic disease risk and decreasing intakes of foods found to be protective in epidemiological studies. Okay, so first off, they're not linked to chronic disease eating animal products, right? There might be a weak correlation, but there's no causation link. And epidemiological studies, as we know, are observational, right? Food questionnaire, what'd you eat in the last year? Highly inaccurate. They also talk about given often temporary improvements, unfavorable effects on dietary intake, and inadequate data demonstrating long-term safety for most individuals, the risks of ketogenic diets may outweigh the benefits. And that right there, that statement, right, they didn't flip it, which caused me to think, who funded it? Well, now we know who funded it. And so let's get into it. So this is how they categorized each of the diets, right? They actually broke down ketogenic into 5 different groups. Honestly, I don't know. I don't know that I agree, right? So first, the 4-to-1, that's the typical diet for epileptics, right? That was 100 and whatever years ago that they started using it to help epileptics with seizures. So I would be considered a modified ketogenic diet, right? I don't believe the low carb, less than 130 grams. I don't think anybody should be over 100 grams, but that's just me. But I do typically, based on the numbers that they gave, I would fall into the modified Atkins diet. Quoted as saying, extreme carbohydrate restriction can profoundly affect diet quality, typically curtailing or eliminating fruits, veggies, whole grains, and legumes, and increasing consumption of animal products. True statement. True statement. Good job. But then they talk about how very low carbohydrate diets may lack vitamins, minerals, fibers, and phytonutrients. So, vitamins and minerals, no, it may not. Nope. Fiber, who cares? It's not required. We'll go over that. And then phytochemicals, don't need them neither. Low carbohydrates are often low in, again, no. And then it got me wondering, reading that, like, so where did they come up with the daily recommended value? Honestly, I think a lot of them were just pulled right out of the old end. And so I don't really believe in the daily recommended numbers. I think they need to be reevaluated, and I think they need to be corrected. And so they do go on to say that even when consuming only nutrient-dense foods, a 4-to-1 ketogenic diet is reported to have multiple micronutrient shortfalls. Again, 4-to-1, that's for the epileptics, and no, I don't agree that there are micronutrient vitamin mineral shortfalls. I thought, well, let's look at what I typically eat and what it has in it. Now, I did find this at optimal.body.nutrition, and it is cow. My favorite meal is cow. Probably 80% of my nutrition is cow. Now, what I did learn is that this chart does not show everything that cow has, but The serving size is 3.5 ounces. Okay, I just got done with dinner. I ate a 20-ounce ribeye. So I am eating 6 times the amount that is shown here in the charts. I am getting well over what I probably need. I don't know. I feel great. So is it really over what I need, or is it just over what they recommend? So think about that. Next is beef liver. So, right, the most nutrient-dense food on the planet is beef liver, right? Next to it is beef. So, beef liver, I actually take it and I incorporate it into my hamburger meat. So, I eat beef liver, but bless your heart, if you can eat it by itself, that is fabulous. I cannot. I have to hide it like I'm 5 years old, so I can't taste the beef liver. But I do eat it because look at everything that is in beef liver. Okay, there is just packed with vitamins and minerals. It's ridiculous, okay? If you're one of those people that you do like your chicken, I don't eat chicken very much, maybe twice a month. I have chicken thighs, which stay away from chicken breasts. They're way too lean. Eat the chicken thighs or the wings or legs, but those are just so much work. So I just eat boneless chicken thighs. This is 3.5 ounces. I typically eat 10 to 12 ounces of chicken when I do eat chicken, so I would be getting substantially more than what is listed here, which is a fair amount. Okay, the other thing that I do eat probably once, maybe twice a month is 6 to 7 ounce salmon. So again, twice as much as what's on this chart. But look at all the vitamins and minerals in a 3.5 ounce piece of salmon. Now double that, and that's what I typically eat. So I do not agree with the lacking vitamins and minerals being on a ketogenic diet, because I'm not. So I thought, well, what are potential deficiencies in a vegan diet, since this article was funded by vegans? And this is the list that I found on medicalnewstoday.com. I found it on several different ones, but this one actually gave it in a neat little chart, which is why I'm using it. Sorry, not that creative. But you look, and it is short several things. So if you're going to be vegan, and again, I will not promote vegan, I will not promote vegetarian, but you do you. And if you're going to choose one of those, make sure you supplement. Please make sure you supplement, because you are not going to get everything you need in just plant product. Well, then I thought, well, what does it show health problems being vegan, right? And so this article that I found this chart in was research shows that vegan diet leads to nutritional deficiencies, health problems. Plant forward, omnivorous, whole food diet is healthier. I don't agree with that. If you look at our teeth to our whole, we are designed to be meat eaters. I don't believe that we're meant to be 100% meat eaters, but I do believe that we're meant to be at least 80% meat eaters. And so I don't believe in the whole omnivorous thing. We're not omnivores. We're not herbivores. Stop it. But look at all the issues that you can have, right? So there was a lady in Australia. She was convicted of killing her 2-year-old because she forced him to be vegan, right? She didn't give him a choice. She cooked him what he had, and that's what he got to eat, and he wound up dying. They're also looking at a link between parents of vegan vegetarians that give birth to children and the incidence of autism. Okay, they're also looking at that people with higher cholesterol have a lower instance of Alzheimer's. And so be honest with yourself, and people need to start being honest with us of the pros and cons of the nutrition that we're using. And then the article went into about a page of fiber. I couldn't bring myself to screenshot or quote any of it, because you don't need fiber. You don't need it to survive. You don't need it to thrive. Okay, that was one of the big bullshits that we were told. You just don't need it, right? And if you think you do, look at any carnivore channel on YouTube, right? Anthony Chafee, he's a doc. He's really interesting to listen to. Dr. Sean Baker. There's the beef butter girl. She used to be vegan, actually, and then she went carnivore, and she looks way better. And so, but they are straight carnivores, so they do zero fiber. And guess what? They ain't dead. They don't have intestinal distress, right? They don't have issues. So no, we don't need fiber. So then they go into different disorders, issues, problems that they're looking at. And so the first one they talk about is seizures, right? And they're quoted as saying, long-term adherence is challenging as food choices are limited and adverse effects are common. I couldn't figure out what the adverse effects were. And then they talk about micronutrient supplementation is required. I don't agree with that. If you just have a fatty piece of ribeye, you're getting what you need, right? Stick with cow. You can do goat, lamb, deer, elk, but you got to be careful because some of them are a lot leaner. So I disagree with that. So where do I think that we can see an issue? Well, to me, it's when they started medicating people for epilepsy, right? So the first medication to treat epilepsy was potassium bromide, and it was in 1857 by a Sir Charles Locock. And so it became, well, hey, just take this pill. You don't have to, adhere to this diet. You can eat the carbs and we'll just give you this pill and that'll fix you. And so people went away from and they stopped funding the studies where they were putting people on basically a lion's diet, right? Salted beef, and just the super fatty cuts. And so I think that is probably one of the issues because I think that first off, you start with nutrition. No, I'm not against medications. However, I think we're a pill-popping society, right? If I take this pill, I can still eat what normally screws me up or normally causes whatever. And so we need to get back to basics. Stop putting the shit food in your mouth. Which is what they go over next, right? Is obesity and weight management. We are in a crisis as America. We have so many people that are fat and overweight. It's ridiculous, right? And whether it's learned behavior because their parents were fat and they learned how to eat poorly from them and so now they're fat or whatever, it's a problem. So in this article, right, they talk about a ketogenic diet and the reduced appetite. And the reason is if you're eating like I eat 60% fat, I'm not hungry, right? The fat satiates me. I don't feel the need, like when you eat carbs, it makes you want more carbs. And so that's why it's satiating, right? And they compare it to a less than 800 calorie a day diet. Like, let's see, eat a ribeye. I eat about 3,000 calories a day. Or restrict myself to 800 calories a day having carbs in there. No, thank you. I'll take the ribeye steak day in and day out. So then they did talk about a study saying that it did suggest, again, words matter, suggest that a low-fat vegan diet may be more effective than a ketogenic diet in suppressing appetite. I would love to see, I couldn't find the frequency questionnaires that they asked. I wish I could find those. It was just ridiculous. Like, how in the world did that work? But when they did this study, it was a study with 20 people. Okay, not a huge study. They did 2 weeks of vegan, 2 weeks of keto. It didn't say if there was a cleansing period in between. It didn't say did they all do keto and then all did vegan, or did they all do vegan and then all did keto? Because that order matters, right? That order can change the results, and if they're not having a cleansing period in between. So then they went into type 1 diabetes, right? As we know, I feel so bad for type 1s. It's genetic. They're born with it. Bless their hearts. It's just something they got to deal with. So they did talk about a comprehensive review strongly discouraged sustained ketosis. And so this is where I believe they get into the weeds on the ketogenic diet. So the study that they cite, the conclusion from it said that it needs to be emphasized that measures need to be taken to prevent the elevation of ketone levels, except when deemed necessary clinically. And so they're not saying don't do a ketogenic diet. What they're saying is, right, you need to pick the right ketogenic diet and you need to stick with it, right? That's probably the hardest part for people because if you go in the grocery store, 80% of it is just shit. It's not food, right? It's just shit. We shouldn't be ingesting it, anybody. But they're also quoted as saying diabetic patients who most frequently experience hyperketonemia, can prevent it by strictly abiding to their insulin treatment regime. just because you try a ketogenic diet doesn't mean voila, you're going to have ketoacidosis. Most people, like for me, I've been ketogenic for 13 years. My ketones don't get very high. So I stopped looking at them. I used to be a freak and like every week, check my ketones before I eat, after I eat. And now it's just, I feel great. So we're good. So they did talk about type 2 diabetes, right? Of course, you got type 1. Let's talk about type 2. Talk about the keto diets, right? They depress appetite because you have the higher fat content, promote weight loss, combination because you're not eating the carbohydrates. Fat doesn't make you fat, contrary to what we were taught as a kid. Reduces blood glucose values, exactly because you're not ingesting the carbohydrates, and decreases A1C in the short term. Actually, it decreases it, right? I just had mine done and mine's 5.4. So, but I don't know that they checked long term, right? I don't know if people fell off the wagon and aren't ketogenic anymore, and maybe that's why their A1C changed. So they did talk about the study, and it was 17 people, again, not a very big study. They did a baseline diet for 4 weeks of 50% carbs, and then a ketogenic diet, 5% carbs for 4 weeks. I have a hard time with a 4-week study. I think depending on how long you were poisoning yourself, you might need to do it a little longer. And honestly, I don't think anybody should be 50% carbs, but that's neither here nor there. So total cholesterol, LDL, C-reactive protein increased, which, okay, like what total cholesterol? What are their triglycerides go down? Their HDL go up? Like that matters, right? And the LDL only matters if you have other markers. Now, if you're type 2 diabetic that's overweight, smoker with metabolic syndrome, then yeah, you might want to look at your LDL. And then fasting insulin and triglycerides drop. Perfect. But what happened to the HDL? That's just as important, right? So then they quoted as saying that a recent meta-analysis, again, that just takes a bunch of studies and looks at them together. And if they're all observational and they're all shit, then are they worth anything that they're written on? But it showed that reductions in hemoglobin A1C achieved with carbohydrate-restricted diets typically wane after a few months. Okay, so I want to know what happened, right? Because I don't think it just wanes. I think you've changed something. Whether you're like, well, I can have that one cookie, or I can have that one cracker, right? That's what I'm more interested in. But I did look up, so they referenced 47, and there was like 120 references in this article. BMJ.com, right, where they talk about the efficacy and safety of low and very low carbohydrate diets on type 2 remission. So I thought, well, let me look at it, right? Well, one of the problems is that, so they say that in that BMJ, that for the purposes of this review, they refer to diets with less than 130 grams a day, or less than 26% of calories from carbohydrates as low carb. Okay, I'm 5% carbohydrates. So someone that has 5 times as much carbohydrates as me, they're considering low carb. So you got to look at that and take that into consideration. So in the discussion of the BMJ article, they talk about patients on a low carb achieved higher diabetes remission rates at 6 months. Well, that just makes sense, right? You're even at 26% carbohydrates, it's less than what a lot of people are eating, which is 50 to 65% carbohydrates. So yeah, you should see an improvement. Increased weight loss, reduced medication use, improved triglyceride concentrations at 6 months, okay? But then they say the benefits diminished at 12. So what happened, right? And a lot of times it's just when they do a 1-year study, they usually have 50 to 65% actually complete the study. And so I couldn't find out where it said that or why that happened, but it'd be interesting to see. So in the article's conclusion, they talked about that adherence for 6 months may experience, right, greater rates of remission, which makes sense. All the articles, testimonials I've seen of people, they've either reduced their insulin use or gotten off of it altogether. But it says, obviously when that's compared to other diets, but they didn't say what the diets were. The one I was concerned about is where they say some evidence shows clinical worsening of quality of life. I don't know where that was or what that is or how that's defined, because all the information I've seen, people have felt better, right? They're outside playing with their kids more, they're doing more things. So it would be interesting to see what the worsening quality of life was. Was it just the fact that they couldn't have the ding-dongs, ho-hos, cornbread, and crap? Or and then it talks about are associated with increased mortality, low-carb diets. I would love to see, and so I looked at that reference 73, and I said, well, what in the hell, right? Well, it's observational studies. And when you look at the hazard ratio, right, so 1 is a nunner, and then it either goes down, which shows a benefit, or it goes up, which shows a possible correlation, right, or concern, if you want to call it that. It was like 1.2. Well, really? Because the risk of lung cancer from smoking is between 10 and 30. So maybe this is naive of me, but if a hazard ratio is less than 2, like, you got bigger fish to fry than what they're trying to say. So I found an article contrary to what they were saying, right? So this is in Scientific Reports. It was October 2024, right? And it talks about the keto diet may, again, I'm sure this is observational. Honestly, I didn't dive into that one. I was tired by that point. Potentially reduce all-cause mortality without the concurrent increase in cardiovascular-related mortality, which is consistent with all the research that I've done so far, right? Saturated fat does not cause heart disease, right? They've known that. Fat doesn't make you fat. And so it's important to understand that. So next they went into non-alcoholic fatty liver disease. And again, these are epidemiological studies, so observational surveys, questionnaires, what'd you eat in the last year, the last 2 years, longest I seen was 4 years. Like, seriously? Who the hell can remember what they ate in the last 4 years? Anyways, they talk about diets high in saturated fat, trans fat, no, simple sugars, no, and animal products, especially red meat and processed meat, and low in dietary fiber and omega-3 are thought to contribute to non-alcoholic fatty liver. See, these words matter. They're thought to contribute. It hasn't been linked, right? There's no causation, causative link. And I don't eat trans fats. I don't eat simple sugars, right? I eat animal. I eat saturated fat. So I looked at this citation 57 and thought, okay, well, what did it say? Well, it said the major established risk factors for non-alcoholic fatty liver disease include obesity, insulin resistance, and dyslipidemia. Okay, so it's more than just you ate saturated fat, right? That's not actually the problem. So then they were quoted as saying that, right, 15% is dietary lipids, right? Lipolysis of adipose tissue, so the fat on you, is 60 to 80%. And the de novo lipogenesis is 5%, right? So that contributes to the pool of lipids stored in the liver. So the big issue is if you have extra body fat. And we're talking a lot of body fat, right? I still have body fat on me, right? It's not looking, well, see, you ate saturated fat, so look at your fatty liver, because I got news for you. I had a liver scan done last year, and my doctor wanted to pull another doctor in because he had never seen a textbook picture-perfect liver before. And I've been ketogenic for 13 years. So, again, take that for what it's worth. So next they go into cancer, right? And one of the issues I have is they talk about the so-called Warburg effect, right? Whereby cancer cells increase glucose uptake and upregulate glycolysis even in the presence of oxygen. So, it's more than just a so-called Warburg effect. The gentleman got a Nobel Prize for his research, right? So this is Otto Warburg, right? He discovered the real cause of cancer in 1923. And they gave him a Nobel Prize in 1931. So it's a thing. So he did find out that cancerous tissues are acidic, right? Whereas healthy tissues are alkaline. And so what he determined that it takes 400 times more glucose or sugar to feed a cancer cell. So why would you want to be on a high carbohydrate diet? And if you get cancer, why would you want to stay on a high carbohydrate diet? Because whether it starts out as sugar or starch, it all turns to sugar in the body. And that includes eating fruit, right? Because fructose goes through the liver for processing. Again, looking at that fatty liver disease, that might be something else that they can look at. So other topics that were covered, Alzheimer's disease, cardiovascular disease, kidney health, pre-pregnancy and pregnancy. I went through all of it, but honestly, I just don't have the strength to go over all of it. And I don't want the video to be so long. Maybe I'll do that in a subsequent video and cover the rest of those. But again, it's the same. It's observational studies. They're trying to make a case for plant-based. And we know that people with high cholesterol are less likely to get Alzheimer's. They're looking into the research about the kids being born autistic from vegan, vegetarian parents. They've disproved that saturated fat, that cholesterol causes heart disease. Kidney health, when they were talking about that, I found it fascinating because it's estimated that 80% of kidney stones are caused by oxalates, which are found in vegetables and nuts. So not sure about that one. And then pre-pregnancy, pregnancy, I wish to God I would have been ketogenic when I had my children. I think they'd have been way better off in the long run. So for the conclusion of the main article, they're quoted as saying, right, ketogenic diets, they reduce seizure frequency, they reduce body weight, they lower glucose, but then also says that the efficacy typically wanes within a few months. I disagree. As a 13-year ketogenic carnivore type person, my last blood panels looked good. I actually have another blood set going to be done in April, and I'll go over that one as well. They go on to talk about how these types diets may increase chronic disease risk. That's not proven. That's, if anything, a weak correlation, because it's typical that people that eat meat, they're more likely to drink beer and smoke. They might be less likely to exercise, right? Whereas a vegan, they're typically non-smokers, right? If anything, they might drink wine, and they exercise. Not to say that meat eaters don't. I mean, shit, I exercise 7 days a week, but it depends who you get in your study and ask the questions to. And then they do talk about, foods and dietary components that typically increase on the ketogenic diet are linked to an increased risk of chronic kidney disease. Again, no, that's not a thing. I have yet to see a causative link from a randomized controlled trial, right? It's all observational, and they rarely, if ever, use an actual ketogenic diet. And then they also talk about protective foods, right? There's the vegan bid for the vegetarian diet there, saying that it decreases when you intake these. Again, that's not shown that veggies are protective. If you find the study, if you know of the study, please send it to me in the comments. Shoot me a link, because I would be fascinated to read it, but not if it's an observational study. I want to see a randomized controlled trial, kind of like the 1928 with Stephenson and Anderson, where they were vegetarian forced to be carnivore, and they allowed themselves to be locked up for 2 and 4 months so they can regulate them, and showed that you don't die on carnivore, you don't get scurvy on carnivore, and actually he felt the best he ever felt in his life. So then they do talk about that current evidence suggests that for most individuals, the risks of such diets outweigh the benefits. I 1,000% disagree with that statement. Again, you'd make your decision. I made mine 13 years ago when I chose to drop 50 pounds. And I have not and will not put it back on because I will not go back to that way of eating. So, something I just thought I'd add, because as it was going through all these different samples, it kept talking about plant-based protein. And I thought, what the hell is that, right? So, for example, these are all 3.5 ounce servings and how much protein each of them have. So, for example, tempeh, right? It's got 20 grams of protein. Sorry, don't want to eat tempeh. But if I have a 3.5 ounce ribeye, I get 24 grams. I just ate a 20 ounce ribeye. So I will take the meat all the time. Besides the fact of all the gastrointestinal distress that you get from eating plant products. That's what gas and bloating is. It is the plant products fermenting, rotting in your large intestines. As long as I stay off the veggies, guess what? No worries. I have no gas. I have no GERD. I have nada, nunc. I just feel good. So, what's the moral of the story? Research, research, research. And not just look at the abstract. You got to get just nuts deep into the research and hit those links that they say, well, according to this person, well, what is that person, right? And what is their stance? So first, who funded the study? In this case, it was a vegan group that funded the study. So yeah, like they're going to say eat animal products. Give me a break. What parameters do they use, right? You saw the 5 different types of ketogenic that they use, that most people are modified Atkins is the way that they describe it. And so that matters, right? Because what I find is that most studies aren't actually looking at ketogenic. They're looking at some weird concoction that's closer to a standard American diet than anything else, right? Was it observational? Epidemiological, they love that sciencey term, where they give you a food frequency questionnaire once every 6 months or 12 months or every 4 years and say, hey, what'd you eat in the past 4 years? Or was it a randomized controlled trial? Like my last video was a randomized controlled trial where they taught the people what they need to be eating. They had them use a food app. And now granted, if you ain't actually weighing your food, you're just speculating on how much you're eating. And I am one of those people. I'll weigh my steak before I cook it just to see how much I'm eating. So again, just because it's randomized controlled trial doesn't mean it's perfect, but it's better than observational. And then what's the duration? For example, that one that was a 2-week study. Sorry, not long enough. If you've been treating your body like a trash can for the last 40 years, you should probably be on whatever you choose for a year. Right? Now, again, I will not promote vegan or vegetarian because I believe that we are by design carnivore. Not 100% carnivore because God made us a miracle and it's amazing the shit that we can survive on and not drop dead. But we are animal-based. I believe about 80% if I had to put a number on it, because people love going, see, she said 80% animal products. Yep, you betcha. But I do think that God made it so we can have some fruits, some veggies, and some grains. The problem is what we as humans have done to that food. That's the problem. So if you appreciate the time I've spent researching what the truth is, consider subscribing. It took me 3 days to put this video together because I wanted to dive deep into the research and see what it really said. So send this to a friend. Again, I will continue to make these videos as I come across these articles, and I will hopefully spread the word as best I can that we are designed to be meat eaters. Period. End of statement. And with that, I wish you a blessed day.